Namaskar. It's my pleasure to invite Dr. Parimala Devi, who has been a gynecologist obstetrician for 38 years. More than that, she has got a Guinness World Record in screening the patients with the cervical cancer. And not only that, she has got a Aryabhatta award also. And with the rich experience that she has, here we have Parimala Devi to explain to us what is cervical cancer. Please let us know.
Good morning, madam. And it's my utmost privilege, I can say today, that I have been asked question regarding the health by none other than the renowned teacher who has been very popular in the world, I can say internationally famed, Madam Dr. Vijaylakshmi Balekundri, who was my teacher even in my MBBS days. She was the one who taught us where is heart, what is ECG, how do we go about it, my medical teacher. Because of that, still I can understand some of the problems other than my OB-GYN, my patients. Thank you very much, madam, and this is my auspicious moment to go ahead. Coming to the question about cervical cancer, I really appreciate you because being a cardiologist, renowned cardiologist, pediatric, you are drawing your attention to the one of the important problem what women are facing. Even though we say gynecologists have to see, but it shows that your concern for women that all have to be happy. All women have to be happy because women is the nucleus of the family, healthy, because she is the nucleus of the family, and around her all the happiness revolves in the family. That's one thing. So when we come to cervical cancer, this cancer is having an incidence of about nearly about 20-22 per 1 lakh delivered women. We can say that nearly 1 in 8 women die because of cervical cancer. Even though I am speaking about the cervical cancer since nearly 2000, after my all post-graduation, after my colposcopy position, but still the incidence has not changed much, madam. It is only very less, 1 or 2%. That's why learned people like you, when you ask about this, I'm very happy to be part of your program because cervical cancer, it comes from a one reason. We know the reason. What is the etiology here? If we go for breast cancer, we don't know the etiology. It may be some theory, it may be lifestyle, something like that. If you go to like other cancers like blood cancers and all, it is some other theory. But here there is one virus called as human papilloma virus. Like how we know that human immunodeficiency virus, everybody knows because of the AIDS disease.
Correct.
Like that, human papilloma virus is the one virus. Because of that virus, cervical, whatever we call it as the mouth of the uterus, here it will attack. So how does a woman get this cancer, this cervix? That is the mouth of the uterus is usually what we say is the way of transmission is by the sexual contact.
Okay.
Sexual contact is one of the contact which a woman or husband, wife goes through when they get into wedlock. But it can be, of course, the other contact also because the same virus is there in the mouth also, in the oral cavity also. The same virus is there in the anal canal also. So because of that, just the skin to skin contact of a person to person, it may be male or female. It need not be husband and wife also. So skin to skin contact, especially the genital area, can transmit this virus enormously to the cervix. Once it enters, some of the viruses are very virulent because there are some 200 types of HPV virus. If the same virulent virus like 16, 18, some which are noted, if it keeps on attacking this part, then it may slowly develop some kind of ulcer, a small growth. Then it may be prone as the day advances, not immediately, because cervical cancer is a silent disease. Like viremia and all, it doesn't do, like some malaria or something. It is silent. Slowly the cells in that cervix will change. It will produce and that will be blown into cancer after some years if they don't take a precautionary steps. Okay. Here comes what is called as prevention. Okay. They should come to the hospital. Any woman, when they are into the reproductive health, they should come to the hospital. If they have any problem, if they don't have any problem, also the health checkup they should undergo, especially the perineal, the pelvis health checkup they should undergo. From that, we will come to know whether the cervix is healthy or unhealthy. That time we can focus treating those small diseases in the nipping the in the bud stage only. We can take it up then and there only. So that will require hardly some few hundreds of rupees. But if it is allowed to grow, then it may come up to what is called as a cancer that is detrimental to her health and also to the family.
Okay. Okay.
So how do we prevent this problem is the question now.
Okay.
We can prevent. One is once they are married, of course, without the marriage also, if they are into sexual contact, they should be always aware that there is something called
Protection.
HPV virus. They should be getting rid of the infection whenever there is some white discharge, or if they are bleeding here and there very irregularly, and if there is something like there are other symptoms of postcoital bleeding, if they suddenly bleed after their sexual contact, all these are very important findings. I don't mean to say that all white discharge are some cancerogenic, but
Okay.
that is one sign like we should alert them. So they should go and get a pelvic examination done. Once that pap smear, what we call it as pap smear, people have a lot of hesitation to go for this pap smear because they think that it is
very simple
very simple one, because they feel very shy also and they feel very hesitant to go and get it done. It is a very simple test. The discharge in the vaginal area is taken out and spread over a slide. That will give a lot of information whether this woman is healthy regarding the cervical cancer or is she is healthy. Once that idea we get, the lady can be just guided to be to herself, but it should be repeated because they are into life,
Okay.
the life of whatever their sexual activity, and also spreading by other ways. From the anal canal also the virus can go. So this should be taken care.
So in other
And this
words, you are
vaccine
saying
should be
that
given to.
better to have a very hygienic way of living. But
Yes,
now,
yes, yes.
apart from the protected sex, the vaccine is there because in the last budget, our finance minister,
Yes.
Srimati Nirmala Sitaraman, she announced the budget for the vaccine for both boys and the
Correct.
girls. So that means, the whole government has given importance for the prevention of this cervix cancer. Will you throw some light on that, ma'am?
Yes, yes. The human papilloma virus vaccine is HPV vaccine, what we call commonly available. Quadrivalent 4 is available, quadrivalent 9 is available. It is neutral gender. I mean to say that it can be given for boys also and girls also. So this vaccine has been available since nearly 1999. That was the time I had started my colposcopy work. But people were very hesitant to take it. Even now also there is not much of improvement. Some people say that because of the vaccine something happened. During COVID time, they were running and taking the vaccine because it was a life or death situation for them.
Scared.
They were scared. They wanted to leave. Somehow, जान बच गया तो बच गया बाबा और क्या नहीं चाहिए, like that it was.
So
But now it is not like that. Yes, HPV vaccine is not a live vaccine. It is a dead DNA content is taken from the virus and the antigens are produced. This vaccine, when we give to young girls, adolescent girls of 9 to 14 or 14 to 26, this age group, it will produce a surge of those antibodies that will control this virus from attacking the cervix. Even though it attacks, it will be nullified. This is the one thing. So HPV vaccine, which is made available since long, long time, already nearly since about 10 years, is taking its more progress, but it is available now. The more and more progress is going on in every association, everywhere in the camps. They are coming, even though they have some reservation. So 9, 14, 9 to 26, when we give, it will protect. But after that also, a woman should take, and also man also is vaccinated.
That is very, very important because he is the source of infection. And that's the reason even the boys have to be protected so that they don't spread it to the girls. So how did they think of that?
Yes, this is because we have to really look with pride with the other countries, neighboring friend countries like Australia and all. They started vaccinating this. The research and all, when it was more and more evident, semen is the source of infection because of lots of human papilloma viruses are there in semen, in the anal canal secretions, in the mouth. So they found that then even this gender also should be vaccinated. Then it started spreading. And these days we are trying to vaccinate. Sometimes husband and wife they come and take the vaccine. I feel now India is progressing. India is progressing. Mother and adolescent daughter, mother and child daughter they come. Mother and son and daughter they bring and they take, the full family takes the vaccine. So it is because the male, even though he is responsible, but because of the biological secretions, but it is how a female keeps herself hygienically, how she gets herself periodically checked up, All these things are very important.
Okay.
Along with that, if they have a smoking habit or some, as you said, madam, like the sexual hygiene is not there, all these things can contribute to cervical cancer. We should
Obesity,
fight for
diabetes.
this cancer.
Yeah.
As basic doctors, madam, you are now cardiologist. Even though you are cardiologist, you are trying to throw light. So all should join the hands, because every year we are losing 75,000 women for this dreadful cancer.
Very.
Even the breast cancer is increasing now. 1 in 8 women is dying because of cervical cancer. 1 in 22 women is dying because of the breast cancer. And 1 in actually ovarian cancer, 1 in 50 we are losing. That is after a very elderly age. So because of this, we have to throw light on why cervix, because this organ we can reach it very well in the examination.
Yeah.
In the examination, intestine can we reach, madam? No. Ovaries can we reach? We cannot. They're all in the abdomen organs.
Yes.
Here, a simple examination by a basic doctor or gynecologist, see this cervix and immediately treat it, and she is into her full healthy life. So this habit of examination, getting examined and getting the vaccine as prophylactically and also therapeutically has really improved their evolution. And I request very humbly all women should make use of it. Anywhere it is available now at the cost of some money, or sometimes IMA, somebody are trying to give it free of cost also.
Free of cost to the school children.
Free of cost also. Only thing they should make use of it. Thank you for highlighting this point, madam.
Thank you so much, Dr. Parimala Devi. Friends, you have all heard from the horse's mouth. She has created a world record, Guinness World Record, in screening these patients. And then she has given in detail. So the first thing is, the children, before going to the college or getting married, both boys and girls must be vaccinated. And it is very easy. The second thing is, prevention comes from the hygiene. So Shuchitva is Daivatva. So cleanliness is next to godliness. And the third thing is, since it is a preventable cause, why should we lose the women in a young age? And that's how we know. I thank you so much.
And one more, madam, last line. Please. Along with this science, this Arogya, there is, of course, Ahara, there is Aadhayatma. When the three combine, it will become a wonderful life. For that, you are the example. Thank you very much. And I thank God for giving you as my teacher in my life. Thank you so much.
Thank you so much, Parimala Devi. Thank you.